Hello, my name is Adriana Marino, and I am host and producer of Ben into Balance, powered by The Source. Today, I am very happy to be accompanied by Dr. Kevin Jones. Dr. Jones began in emergency medicine before starting Flow Wellness here in Bend 3 years ago. Dr. Kevin, thank you very much for being here. Can you please introduce yourself and how you began into this path of health and wellness? What took you into the medical field?
Great. Yeah, it's nice to meet you and be here. Well, I initially moved here working as a ski patroller full time, and I studied engineering in college. And I realized I wanted to stay in a mountain town and really enjoyed the lifestyle here. And when I look at engineering jobs, they weren't really a good fit for what I was doing. So I rethunk what I wanted to do in life. And as a ski patroller, we were working with emergency ER doctors here at Mount Bachelor, and I started talking with them and realized that might be a good profession to go into, and took some additional classes at COCC to be able to get into medical school. And I was fortunate enough to do my training at OHSU in Portland, and I was there for medical school and residency, and then came back and started working here in the emergency departments. And I've worked in all the different campuses at St. Charles.
Oh, wow. That's really cool. So it's your love of skiing that brought you to Bend, and then from there into patrol work, and then from there becoming a doctor.
Yep. Yeah, it's been great. The outdoor lifestyle here is phenomenal, and it's just a great town to live in.
And so how was your work in the emergency room? How did that go? How
Uh,
long did you dedicate yourself to this space before starting Flow Wellness?
I've been in the emergency department for 15 years, and I still work there on a kind of part-time basis.
Okay.
But it's really rewarding. It's also really challenging. During COVID, it was particularly challenging when we had coworkers that were living on a trailers because they were afraid of their family getting sick, and the work was either really intense or really none at all, as people weren't coming into the hospital. And it was during that time I ran into a previous coworker who was running or part of a ketamine clinic in town. And ketamine is one of the treatments that we do that helps for mental health, typically used for anxiety, depression, PTSD. And I was telling her about the just stress level of,
Sure.
being in the ER during the COVID
I can
times.
only imagine. It must have been crazy.
I mean, we didn't have it as bad as some of the inner cities for sure. Like I had,
Yeah.
colleagues from years past that were really in the thick of it, but it was still challenging. But I started doing ketamine treatments with that clinic and found it was just really like a nice stress relief, like helped me reset my mindset, and just kind of file that as a way as maybe this is something I should look into more of.
Mhm.
And then I'd always thought about me doing some sort of, wellness type aspect just to kind of balance the ER, and then finally got around to doing it. And so our initial plan was to do IV fluid hydration, which is a popular thing. Athletes do it, people do it for recovery, travel, and then
Mhm.
also add in the IV ketamine component, just because I found that to be so helpful for me personally.
Sure. Your personal experience.
Yeah, and so one of the things that is really challenging in the emergency department is mental health treatment. We keep people there for a long time. They don't tend to get better at all,
Yeah.
and so to have a therapy that isn't for everybody, but does help a lot of people, is nice to be able to be part of that and facilitate those treatments.
Sure.
And then we've expanded on with Flow Wellness into other treatments, particularly something we had talked about before, but like the GLP-1 therapy, mainly for medical weight loss.
Uh-huh.
And it just so happened I opened the clinic right when that craze was happening,
Oh, I
and so
see.
when, Ozempic was in the news every day, and it still kind of is to some
It
extent.
is, yeah.
And then the medications weren't really available, but I had relationships with compounding pharmacies that were producing the medication. And I just started asking around, and within, a couple days, I had a dozen people that were like, "Hey, I either been on this medication and can't get it, or I've been interested in it. I want to lose some weight." And that's where we really took off, and it's been really rewarding to be part of that experience and help people change their lives with obesity.
Can you tell us a little bit about Ozempic and the GLP-1s in general, how they began, how long they've been in the market? Because many of us think Ozempic as a household name, like just in a couple years ago, but it's actually been around since 2005, if I'm not mistaken, or these type of drugs at least. Can you give us
Correct.
a
Yeah,
little
they
bit?
were first developed for diabetics to help manage blood sugar, which is something that Ozempic does do. And it was really a incidental side effect that people were losing weight while taking this medication. And the initial drugs, the one that were around in the early 2000s, you had to take either once or twice a day. And so for weight loss, that's not a very appealing thing, but for diabetics who rely on insulin, they're used to
Sure.
doing daily shots, so it wasn't a big thing for them to take those medications.
Uh-huh.
And what really changed is when they were able to make the medication last longer from daily to weekly and then start looking at it just for the sole purpose of weight loss. And the original medicine for that was called semaglutide or semaglutide,
Mhm.
also known as Ozempic.
Okay.
And then that just, it just hit a tipping point where people realized it was effective and for the most part safe with, not, there are some side effects, but most people can manage them. And now there's newer medications like tirzepatide, which is also called Mounjaro or Zepbound. There's pills now available where you don't even have to do the shots.
Okay.
And then there's even newer medicines out there that are approaching like what the level of bariatric surgery is for weight loss. And so it's just a real exciting field to be part of and see where it's going.
Wow, it's really grown fast in such little time.
Yeah, I mean, the tragedy with obesity is that it affects so many parts of people's lives. It's linked with higher risk of heart disease, cancer, stroke, longevity, and there just really wasn't a treatment for it.
Yeah.
We would, I mean, not so much in the ER, but primary care doctors would say, well, exercise more and eat better, but that only gets you to a point, and then with ultra processed food, it's pretty hard to monitor calorie intake. And so we were, even though people were trying, this is what I hear from a lot of the patients that I've treated,
Mhm.
they're doing their best, but just not getting where they want to go.
Yeah.
And also just at middle age and getting older, your body slows down. So for a lot of people that were at a healthy weight, that changes over time. And now we have this medication that can help people get to where they want to be and feel like themselves again. It's really phenomenal.
Yeah. This reminds me of in my past, I was a filmmaker and I did a 1 hour special for National Geographic on obesity. And I went to Monterrey, Mexico, and I met at that time the world's largest man.
Oh,
His
wow.
name was Uribe, Miguel Uribe, and he got the Guinness record of being the heaviest man, and he was at almost 600 kilos, which is close. I'd have to do the math, but I think that's over 1,200 pounds. And when I met him, he had been living on a mattress for the last 13 years. And on that mattress, he had to do everything, all his bodily functions. He could not get up from that mattress. And he had been literally bedridden for 13 years. And if he wanted to see the sun and get out, they had to transfer that mattress to the back of a pickup truck. And then they would drive him through town and he would just kind of be exposed to the sun and, of course, to the city. He was obviously well known. A lot of people went to go visit him. Anyways, he sadly passed away a couple of years later, but I think he died around close to 40, if I'm not mistaken. He was probably in his late 30s when I met him. But it was a very impactful experience to see him just really glued to that mattress and knowing that he had been there for 13 years was very hard to conceive. So that brings me, to the need of why these drugs could be useful because he was unable to lose any weight. Um, can you tell us, when a patient comes to you, like what are the factors that you're keeping in consideration as to why this patient should be eligible or not to take these new medications?
Yeah, it's a great question. There are criteria which we base off the body mass index, which is a calculation based on your height and weight,
Mhm.
and then also factoring in other risk factors, mainly for heart disease, like does that person have diabetes or high blood pressure or bad cholesterol or a family history of heart disease? And so those are the kind of traditional things that we look at for GLP-1 medications.
Uh-huh.
We are seeing it used a lot more commonly now for other conditions, mainly in the longevity space. There was a large study that showed semaglutide, which is the original weight loss medication, had a 15% drop in all-cause mortality for people who took it over a study period.
Uh-huh.
And so people are looking at this, say, hey, I can actually use this medication to help live longer. There was a large study looking at it for dementia, which didn't really pan out. So that's still up in the air.
Okay.
We've also had patients use it for inflammation,
Uh-huh.
like pro-inflammatory states of the body. And, fat cells are pro-inflammatory. And so if you can lose weight, you can decrease that inflammation.
Sure.
And so we have the traditional things, which is just truly excess weight, like a
Mhm.
BMI over 30, whereas over 25 is considered obese.
Right.
Over 25 is considered overweight, over 30 is obese.
Mhm.
And then also folks that are looking at it for kind of what we consider like non-traditional treatments as well,
Okay. And non-traditional treatments would be like what?
like the inflammation
Okay.
components. Fertility, like we've had folks become pregnant after losing weight because, being overweight is not that doesn't put your body in the healthiest state to have children.
Uh-huh.
Um, yeah, and there's a recent New York Times article about someone using it for a head injury, which is new to me. I hadn't heard of that, but who had a severe concussion and actually found getting on a GLP-1 medication helped their concussion symptoms. So it's in the news right now. There's just a little bit of everything that you're hearing about the
Uh-huh.
how GLP-1s can help, and maybe not all of that is 100% accurate. It's going to be
Yeah.
backed up by study data, but we are seeing a lot of benefit for things that we didn't even know about.
Okay. And the patients that come to see you here, in general, what are in what category do they fall in? Like the non-traditional or more just weight loss, looking for longevity benefits? What are you
It's really a
finding?
mix of both. I would say on average, it's an older population for the most part. We're mostly seeing people 40s, 50s, and even a handful of 60s, 70s.
Uh-huh.
Um, and the middle-aged folks are really what I hear over and over again is I was doing fine. I'm eating right. I'm exercising. I live in Bend. I get out, that sort
Yeah.
of thing. But I just, the pounds just keep on adding on. And it's so true. I mean, it's statistically shown. I mean, people in middle age, people gain on average, roughly a pound a year.
Hmm.
No matter how hard you're trying, as your body's just slowing down. And, eventually gets that affects people. Either their exercise tolerance goes down, they have a health concern, maybe, a health scare of some sort, and they want to get healthier. And
Hmm.
so what we're seeing is folks that, are hitting that point where like, I've heard of this treatment. I know I'm getting worse. I've done everything I can to get better. Like, would this work for me?
Sure. Are there any red flags that you look for where you think that the drug is not compatible for that person?
I mean, the biggest thing we'd screen for is something called body dysmorphic disorder,
Uh-huh.
which is, people who are already very thin who want to become more thin.
Sure.
And that's pretty obvious when they walk in the door
Yeah,
and
that they don't
or
need
what,
it.
their BMI is.
Uh-huh.
And surprisingly, that's very uncommon. Like I can count on one hand how many people I've seen personally that, I'm just like, this isn't a healthy situation for you.
Yeah.
We do have to be careful with folks looking at like the inflammation benefits that they don't
Uh-huh.
lose too much weight. Cause if we're treating something else, but the main effect is weight loss and we don't want them to get unhealthy. And that's something we actually track with the body composition scans. So we can look at their muscle mass, their fat mass. A big buzzword right now in health is visceral fat, the fat
Yes.
that's around your organs,
Uh-huh.
because that's considered more dangerous for heart disease. And so we can track that and see if it's getting better. And so people are looking at that. Well, how do I improve my visceral fat, whether that's with GLP-1 or something else?
Okay. So tell me a little bit of the process. A patient comes to you and you filter them, you ask the necessary questions. You understand that, they're eligible, I guess, for the medication. What does the process look like? Like
Yeah, so
how
first they meet with a provider.
Mhm.
If it's an in-person visit, we do a body composition scan. And when we meet with them, we're going to talk about like, what their journey has been. Like everyone has like when did it comes out pretty naturally. Like when did you feel like at a healthy weight? When did that
Yeah.
change? And what do you think changed? And how's your diet? How's your exercise? And usually there's sometimes there's a trigger, like someone I talked with today had an injury and they were gaining weight because they couldn't exercise again and they're waiting surgery.
Uh-huh.
Other folks, it's just the middle age factor. And then we spend a lot of time. Most of the conversation is really about the risks and benefits of the medication because there are important things to know.
For example, can you tell us a little bit about the risks and
Yeah, the biggest thing is these medicines do have side effects, and
Uh-huh.
so the most common being nausea. And so we wanna warn people about that. Um, and so, not eating too much at once and then, being taking your time starting the medication. We also want people to lose weight in a healthy way.
Mhm.
We don't want them just shedding pounds by the week because that puts you in a starvation state and you start losing muscle.
Yeah.
Also, the way the medication works is it really just slows down your whole GI system.
Uh-huh.
And so constipation is very common. So we want to talk with people about that.
Okay.
Sometimes people paradoxically also get diarrhea. So
Yeah.
it basically just affects your gut.
Uh-huh.
And there are more rare side effects, mainly more attributed to weight loss. But for instance, if you lose weight, that can increase your risk of gallstones, which can lead
Okay.
to a gallbladder infection, which can lead to surgery.
Uh-huh.
And we've had some patients need to get their gallbladders taken out.
Oh, wow.
But, the gallstones are composed of what's in fat cells. So as those fat cells start breaking down and into the bloodstream, they can lodge in the gallbladder. And there are more serious side effects, which we've really hardly seen any of, but like
Mhm.
pancreatitis, like any medication can cause inflammation of the pancreas, which can be life-threatening.
Oh, wow.
There's a theoretical risk of a very rare type of thyroid cancer that was seen in rat studies. It hasn't been demonstrated in humans, but there is a
Okay.
warning on the drug label, so we do
Okay.
talk with people about that.
Sure.
And those are the main things,
Uh-huh.
in terms of, like, what we warn people about. Then, of course, we just talk about, dosing and, like, what a healthy weight loss target is. And then we follow our patients pretty closely. We wanna see how they're doing and adjust their dose as needed.
Yeah, that's what I was curious about. Like the following, the continue, how the care is provided for while they're taking the drug. Like with what frequency will you see the patients? What is an appropriate weight loss per week? I mean, does that really depend on what their initial weight is?
It does. I mean, on average, 1 to 3 pounds is considered a healthy weight. On tirzepatide, the stronger medicine,
Mhm.
we do have some people who say have, like, 50 plus pounds to lose, and they'll drop, like, 10 or 20 pounds the first month just really fast. We
Wow.
don't want that to be sustained,
Yeah,
but that can happen. But yeah, so we just don't wanna up people's dose too fast, but most people don't want that because if you're gonna feel pretty miserable.
sure.
Like, if you're not able to eat at all, you're just not gonna feel good, so,
Yeah.
we tend to it's just standard in medicine, start low and go slow, and I
Uh-huh.
just warn people that this is a process, it is a journey.
Sure.
You're not gonna get to your goal weight in a month,
Mhm.
and that it's a long-term commitment to this. And, whether it's, if you reach your weight in 3 months or 9 months or a year, this where this drug was studied was actually 17 months of study periods. They were planning on over a year to look at this.
Uh-huh.
And then also the big thing too is to talk about what happens when you get to your goal. What do you want to do next? Because if people stop these medications, statistically, they are going to regain weight.
Yeah, I read that normally half the patient will regain the weight back.
Yeah, it happens very slowly. And a lot of times people will still wind up under where they were before.
Uh-huh.
And so we wanna warn people that, it's not just like anything else, there's no permanent fix, there's no magic bullet.
Yes.
I would say it breaks down. We do have some people that get to their goal weight and then get back to their healthy habits and stay there. I mean, that's probably the biggest minority. We do have some people that get to their goal weight, they do well for a period of time, and then something comes up in their life, whether it's an illness or a family stressor or a life stressor, and they'll call us back and be like,
Mhm.
"Hey, I was doing great for 3 months, but can I get back on for a month or 2?" And
Uh-huh.
so they cycle a little bit, which is
Yeah.
fine. And then other people just really feel so much better on the medication that they just wanna stay on it, and then we just work them to a maintenance dose, like a lower dose, maybe a more affordable medication. And, what people really find that the benefit is that's hard to explain until you've experienced it is the lack of food noise or cravings.
Yeah.
Because when you're living that life all the time, you don't think about it, but people get very food stressed. I know that was an issue for me when I was working night shifts in the ER. If I'd
Yeah.
always feel hungry because I was, using calories to get some energy.
Sure.
And when I started, I'd personally take the medication, and when I started, I did that noise just went away, and I was like,
Yeah.
"Wow, that was really, like, a big part of the background thinking in my life."
Uh-huh.
And now it's gone, and it's really nice.
Yeah.
And that helps with other things beyond food too. People have used it to cut back on alcohol use, that's being studied.
That's fascinating.
Yeah, and so I don't think it'll ever be a true, like, just take this pill or shot to get off booze, but
Yeah.
we do have people that cut way back on their alcohol use, and part of it is the mental craving, and part of it's the physical amount that you just can't drink a bottle of wine on a
Uh-huh.
GLP-1 because your stomach's you're gonna feel terrible.
Wow. Now that you're talking about, all these, psychological benefits of not feeling that noise, that food noise, and the fact that it can help with people who have addiction to alcohol. Can you tell us a little bit about how they work? I find it fascinating what's going on metabolically in our body when we take these drugs. What's going on?
Yeah, so the GLP stands for glucagon-like peptide, and it's mimicking a natural, hormone or peptide, I'm sorry, that your body produces. So every time you eat in your small intestine, you release GLP-1,
Hmm.
and that's basically telling your body that you're full. So it signals to your stomach, "Hey, slow down, we're good."
Yeah.
Signal to your brain, "We don't need any more food." Unfortunately, that peptide, the natural occurring one, only lasts for a few minutes. So there's kinda some fun trivia about the GLP-1s that it was actually derived from Gila monster, um, GLP-1. And so Gila monsters are these like lizard creatures that live in this American Southwest,
Uh-huh.
and they only eat, once or twice a month. So they have a GLP-1 that lasts a lot longer. And so the molecule that was isolated was called exeninin. I might be saying it
Mhm.
wrong.
Yeah.
And that turned into exenatide, which was the first GLP-1 that was released in 2005. So it was a derivative of this Gila monster GLP-1. And so that they found a way to make it last longer.
Oh,
And so
interesting.
when you do this, it's not a natural thing that you're taking. Like tirzepatide is not something your body naturally makes. It's a synthetic version of your natural GLP-1 that's designed to last longer in your body. So it resists getting broken down by other proteins.
Mhm.
And so that's why that feeling of fullness,
Yeah,
like lasts longer than a few minutes. Like it,
I see. And how long can that last then? I guess it depends on the doses, but
yeah, I mean, well, for these weekly medications, the
Mhm.
half-life is between 5 and 7 days. So you take the medication, you have a kinda lower level of GLP-1 is circulating. So I think that's where people also don't get those food noises because their brain's being told, "Hey, it's okay, it's okay." And one of the big misconceptions of GLP-1s is you can still eat and enjoy food. It doesn't affect taste or,
Yeah.
going out with friends or having a glass of wine. Like,
Uh-huh.
those things are all totally back to normal. You're just
Yeah.
not gonna have as much. Like, what I
Uh-huh.
often tell patients is you're gonna start bringing take-home bags from a restaurant, or maybe you
Yeah.
just split an entree with your spouse. You just don't need as much to feel full,
Uh-huh.
and that's the biggest change, and it's just really simple. I mean, if you're taking in half as much calories, to use a rough number, then you're gonna, on average, lose weight.
Sure, of course. Now, when someone begins this medication, what are some lifestyle interventions that should be maintained? I mean, for example, exercise, proper hydration, managing stress, sleep, like where, I mean, as a health and wellness coach, I cannot not wonder about, what are how these other interventions come into play just to make sure that, health and wellness is maintained and we're just not relying on as you say, a magic pill, a miracle drug to kind of do all the work for us. Like, what's the work that the patient still should do?
Yeah, absolutely. I mean, those are really important things for, body weight as well as long-term health.
Mhm.
We do offer nutritionists. People want to work on their nutrition because for some people that might be their weakness is just I just don't eat healthy. I
Sure.
need some planning on that. The biggest thing that we worry about with the medication is that as you're losing weight, you can lose muscle because your body's if it needs calories, it's going to scrounge wherever it can get.
Yeah.
And so obviously it'll start with body fat, but it's also going to pull
Lean muscle
yeah,
mass.
and so that's something we can track, and then we also really encourage our patients to start, exercising if they aren't already. The nice
Mhm.
thing is naturally, as people start to feel better, they start moving more,
Yeah.
which is a great benefit of the medication. It's like, if say someone who's, very large, like they just every time they get off the couch, it hurts, like it's
Uh-huh.
physically painful for them. And that pain's going to go down, as they lose weight. In fact, the medication is being studied for like osteoarthritis, that sort of thing, to
Mhm.
help with that benefit. And so people do wanna do that, but we obviously encourage them, and we have an education program we use at our clinic, but, it's like, here's some strength exercises, and here's what you need for your long-term health. Sleep obviously is important. I mean, that's like
Uh-huh.
the most underrated thing for anything I think in longevity is
I
just getting a
agree.
good night's sleep, and it's so hard right now with social media and,
Uh-huh.
the world and doom scrolling and stress and something I
That's
struggle with a lot.
Yeah, it's something I most coach on as a yeah, it's very common just to suffer from lack of sleep, yeah. So there's a lot of things that you're recommending your patients to do
Yeah, and we check in with them monthly. I mean,
monthly?
we're in a slightly different model, where it's a concierge level. So we want to hear from our people. Every place does it a little bit differently, but it's a journey. So it's going to take time. It's going to take adjustments.
Mhm.
What I will say in this community that people tend to know what they need to do. It's
Yeah.
they know where they slipped up, and so it's less of an issue than I thought, but it's always good to remind folks, it
Uh-huh.
takes sometimes it takes a little, like, push to, "Hey, just sorry, how are you doing with this?" Or, "Looks like you lost some muscle mass. How can we work on that?" We wanna keep you healthy. The last thing you wanna do is feel great and be back to your, regular clothes that fit, but be an unhealthy person. We don't want that.
Sure. Um, is there any kind of counseling that goes on with these patients? Just like, I don't know, psychological counseling about body image, about body weight? Does that tend to accompany this process at all? For those who have
Um
suffered for being overweight or obese?
Well, you hear a lot about how it affects marriages. As one person gets healthy, it really
Uh-huh.
changes the dynamic. In fact, we have a lot of people that come in that will start with us and then bring their spouse in like 3 to 6 months later.
Oh, interesting.
Because I mean, for folks that really struggle with obesity, I mean, it really affects every aspect of their life.
For
And when
sure.
when those things get changed, like they're obviously going to feel a lot better and want to change other things in their life.
Uh-huh. Can you think of any, obviously without any names, but like any stories that have really inspired you, that have really shown like the power of this medication, of how it can really transform a life?
There's been a couple. I mean, one that comes up repeatedly is like one of my first patients had a hip injury and had gained a fair bit of weight. She was younger and she couldn't get her surgery because she was too overweight. And she's like, I'm in this catch 22 where I want
Mhm.
to exercise, but it's painful. I can't, and I can't get this fix that I need because I'm too heavy now. And so she was successful getting back to the weight that she needed to do to get her surgery, and then was fine afterwards. And now, she's not on the medication anymore.
She's not on it.
And I had a consult today with the same story, an older patient who's in the same situation of just, injury, can't, and if you think about it, if you hurt your knee or hip, it
Yeah.
has to be the hips that I hear a lot about. You can't, aside from swimming, you're pretty limited on what you can do for cardiovascular activity,
Mhm.
and getting back down is a goal for them.
And, so once they get down to that weight that they need in order to get that surgery, in order to, enhance that mobility again, do they stay off the drug? What usually happens afterwards?
It's really individualized when
Mhm.
people get to their goal. Yeah, that's we always want to talk with people about like what how they're feeling, what they want to try. I mean, I always encourage people if they're up for it to try weaning off the medication and see how they feel.
Uh-huh.
Because if you don't need it, then you don't need it.
Yeah.
But I mean, it's hard to know exactly, but I've sort of split it up into thirds. Like when I tell people this, like a third of people will stop and stay off of it, a third of people will cycle, a third of people will stay on it. I think that's probably a little bit higher than a third that people will want to stay on it just as a maintenance,
Sure.
just because they're feeling better. They've gotten to where they want to be. Maybe they tried stopping it for a month and those food cravings came back and they started gaining weight again.
Yeah. And for those who are able to who are in that third that are able to stop taking the drug altogether, like what are they doing in their time in terms of their lifestyle in order to keep that weight off and not need the drug anymore?
That's a good question. I don't hear from them that often
Uh-huh.
because our
Sure, yeah.
services. But I mean, what I think they're doing is just getting back to where they were, like in terms of activity level.
Mhm.
I mean, I hear from a lot of patients, I just need a boost. I need a kickstart to get
Yeah.
where I want to be. And that's part of your body's, how it functions, that homeostasis where it wants to stay the same.
Uh-huh.
And that's been looked at like in the Biggest Loser TV show. They did a big trial or big study and they looked at those folks that lost like tremendous amount of weight, but their body's metabolism really slowed down and it wasn't reversible. And so it becomes really hard, especially as you're cycling between overweight and regular weight. Your metabolism is always keeping score of that. And so it does take some time to reset that if that's even
Mhm.
possible. And so, it takes a lot of discipline. I tell people it's easy to lose weight on this medication. It's hard to stop and keep it off, but you should know that going in
Mhm.
because, we'll be having this conversation in, 3 months, 6 months, a year. That, what do you want to do now? But knowing that if you want to stop and get off of it, all those benefits of the mental and the gut systems slowing down are gonna go away.
Mhm.
But I think with a lot of I mean, there are a subset of people that are super disciplined and they get that kickstart that they need, and then they can move forward with it.
Yeah. What do you see the future of these drugs? Do you think they're gonna become more mainstream? Do you think they're gonna be held back? How do you see them evolving to?
Yeah, for a while, I was worried that there was some, like, unknown side effect that was gonna come out and, because there's been diet drugs in the past that have later turned out to be dangerous, like fen-phen. But now that we've had, over 2 decades of this type of medication being out and available, and plus just, tens of millions of people taking the medication, I really don't think there's going to be one overall bad thing that's going to happen.
Mhm.
There could be more future side effects that we don't know about. It's always hard to tell with any treatment.
Yeah.
I do think that I mean, the biggest issue for right now for a lot of people is price because insurance typically doesn't cover this medication
Oh.
until you're a diabetic,
Uh-huh.
which is frustrating because you have to wait to get the illness that is caused by being overweight to get treated for it. And unfortunately, that's just, how American insurance work. It's more for sick care rather than health care.
Yeah.
And so, these medicines are expensive out of pocket. The cost has gone down tremendously. Like when I first started
Uh,
doing this 3 years ago, it was over $1,000 a month. And now either with compounded medication or brand new medication, you can get the medication for, $300 to $500 a month.
Okay.
So quite a bit less, but still, that's still a lot of money.
Sure.
I do think the cost will keep going down as there's more medications out there. I mean, I
Mhm.
think every drug company right now is seeing this as something that they want to get into.
I've heard a lot of pharma's into this now. Yeah.
Yeah, I mean, just to have a fix for really the most common medical problem in the United States. I mean, it's, over 60, 70% of American adults are obese. So being able to have an effective treatment for that is really revolutionary. And I think it's going to, as a whole, help our whole country, live healthier, live longer, just
Mhm.
because there's so many consequences of having excess weight.
Yeah. What are those biggest consequences? Because, I mean, we're getting into the issue of like metabolic health, which is definitely a big driver of a lot of disease that we see here in the United States.
Yeah, I mean, it affects all levels. I mean, the number one, disease that kills people is cardiovascular disease, and
Mhm.
certainly being overweight is a contributor to that. It's gonna, associate with high cholesterol, can lead to high blood pressure, all those risk factors for stroke and heart disease. A big one that I feel like is becoming more common is just the cancer element. Like obesity is linked to, I believe it's over 20 different types of cancers, particularly breast cancer.
Wow.
And so with those adipose, those fat cells being so pro-inflammatory, it's just kind of wreaking havoc in your body. We're
Yeah.
seeing a lot more young people with cancer nowadays. And I'm sure there's more to it than just body weight, but
Right.
that undoubtedly is a component.
Wow. Can you explain to me why, you've mentioned inflammation a lot, and inflammation is definitely a more common word, as that silent killer behind so many of these chronic diseases. How does the GLP-1s work in being an anti-inflammatory?
I think the full extent of it isn't honestly known, but
Uh-huh.
as you decrease fat cells, those are the ones that are producing a lot of inflammatory signals in the body. Obviously,
Mhm.
it's more complicated than that,
Yeah.
but that was a benefit. Like a lot of people didn't even realize that, especially like inflammatory conditions can be hard to treat because there's not like an easy fix. And
Uh-huh.
and we were seeing people with like endometriosis, irritable bowel disease, polycystic ovarian disease, like things that just didn't have good treatments that were really affecting people's lives in a non-specific, like, very ill way, and they're getting
Mhm.
better. And, I mean, I think it's mostly through weight. There might be other mechanisms too. The GLP-1 receptor is in all over the body, and so there's
Uh-huh.
probably things that are still yet to be discovered for that.
Wow. It's interesting to see how much this it's growing, and at the same time the industry and is still discovering all its benefits and possible outcomes at the same time. It's like, there's a lot unknown still, but a lot of interesting things that are coming out as people are more and more taking these drugs.
Yeah, and I think there'll be, as we get more targeted with, AI and all these things, like the medical therapy is just gonna keep on getting better in that regard. I mean, there'll always be an issue of affordability and access,
Sure.
but this is, I think, the tip of the iceberg of what's possible down the road.
Yeah. um so in terms of wellness, how have you seen that these drugs have helped your patients in general? Like, besides the weight loss, what else is happening for them?
I always think of, like, they feel like yourself again. Everyone has that memory of when we were young and healthy, and we wanna aspire to get back to that point, which is always a hard thing to do, but
Uh-huh.
it helps put you on that path. Just, if you can wake up and be, pain-free, moving throughout your day or doing activities that you like,
Yeah.
fit into clothes that make you feel comfortable again, those sort of
Mhm.
things. I think it's really a big self-confidence booster.
For sure. And changes a little bit dynamics in relationships, as you mentioned.
Mhm. Yeah, absolutely.
Yeah. For you personally, you mentioned that it has helped you kind of eliminate that food noise that you were hearing before. What other benefits have you experienced
Well,
through?
I think for me, one of the most striking things is how well my athletic performance got better because I like to ski a lot, but I was,
Uh-huh.
always the slow guy.
Yeah.
And I was like, well, maybe I'm just, this is just me. But as I lost weight, I was like, oh, wow, like I feel much more athletic. I'm moving better.
Uh-huh.
And that was a nice side effect that I didn't really anticipate. I think by not having that food noise, you can also eat healthier because you're just not
Mhm.
eating whatever's right in front of you. So you can be more intentional.
That's a good point.
And so, I use that as a springboard for that element. I think it just makes you feel more confident, I would say. Like that's been a big thing.
Uh-huh. Okay. Um, and another component that Flow Wellness looks at is also peptides,
Mhm.
which is another category in itself, correct?
Yep.
Can you tell us a little bit about peptides, how long they've been in the market? This is fairly new, if I'm not mistaken.
Yeah, so peptides, so GLP-1 is a peptide,
Okay.
but there are all these other peptides, and just to back up a little bit, a peptide is a combination of amino acids. So
Mhm.
amino acids are what also makes up proteins. And you can think of amino acids as like little Legos, and they can get built together. So a small like Lego block would be a peptide, which is under 50 amino acids. That's a commonly accepted number. Over 50 would be a protein. And proteins, as we know, are essential. Like, might make up muscle. Hemoglobin makes up red blood cells. Myelin makes up nerve sheaths. All these things, everything in your body is made of proteins.
Mhm.
And what peptides do is smaller amino acids is they signal things in your body. It's sort of like a text message that goes to one part of your body.
Uh-huh.
And typically what that'll do is activate a certain pathway. Like a GLP-1 goes to your brain, it goes to your stomach.
Sure. The
And
hypothalamus. Uh-huh.
and so there's other peptides that even take a more focused, a narrow role. And it's interesting, these peptides have actually been around for a while. After we initially talked, I did some further research into
Yeah.
this, and one of the most common peptides are what's called growth hormone analogs, and they signal your body to produce more growth hormone. And growth hormone's a hormone that affects everything in your body, and it's
Yeah.
basically how a young person feels young. You could boil it down to that. Like if a teenager breaks a bone, they're back running around in a couple weeks, whereas a 50-year-old breaks a bone, 6 months later, they're still doing PT, feeling miserable. A lot of that is through growth hormone repairing your body and allowing it to recover. And so Samoralin is kind of that quintessential growth hormone as a type of peptide, a
Okay.
growth hormone analog. It's a peptide that helps make your body make more growth hormone. That was actually FDA approved in 1990
Yeah.
as a test to see if your body was making enough growth hormone.
Uh-huh.
And then it was later approved for children who had growth hormone deficiency.
Yeah.
So there are genetic causes that can lead people to not have enough growth hormone, usually diagnosed as a child.
Yeah. My daughter is on the growth hormone since 6 months of age because it was approved for her syndrome. And it gives her a lot of benefits, among which it helps with muscle fat balance and also just like stamina, and it also affects her IQ, interestingly enough.
Oh, wow.
Yeah, it's been approved by the FDA, yeah, for many years for her syndrome. So yeah, I'm very familiar with growth hormone. I have to inject it nightly to her. So you're saying that growth hormone that she's taking is a peptide?
Well, if you're doing straight growth hormone, that's a hormone.
Okay.
Um, and then for what people are typically do is the growth hormone analogs, which are the peptides that tell your body to make more
Got
growth
it.
hormone.
Uh-huh.
And so the tricky thing if you're doing just straight growth hormone is you have to really carefully monitor the levels.
Yes, we do.
And so and too much can be dangerous.
Yeah.
If you stop suddenly, that can be dangerous.
Mhm.
And so and it can have some side effects, particularly in adults. It can lead to bone growth, which people don't really want as an adult.
Right.
And so by using these growth hormone analogs, you're kind of getting the benefits without having to deal with the downsides of like monitoring levels
I
and
see.
having unwanted side effects. And so the
Okay.
peptide tells the body, it's really the pituitary gland is where this comes from in the brain.
Uh-huh.
So that you take that peptide and then it goes to your brain and says, let's make more growth hormone. But it does it on a natural cycle. So your body's not going to make more than it should. It's just giving you more than you have currently.
Got it. Okay. So that's one peptide. But then now there are many peptides out there.
Yeah, there's dozens now.
Uh-huh.
There's a narrow subset that are, like allowed to be compounded that have shown to been safe. And it's
Uh-huh.
kind of a moving target right now. The government's looking at whether some peptides should be allowed again. They were, and then they weren't.
Mhm.
And but the peptides can get broken up into categories. You have the GLP-1s for the food type stuff.
Right.
And then you have the growth hormones, which I kind of categorize into performance. They help with athletic performance, recovery, sleep.
Uh-huh.
And then there's recovery peptides. There's one called BPC, which stands for body protective compound. It was derived from tissue in the stomach that protects your body against all the acid in your stomach.
Uh-huh.
And that's been shown, well, it's been shown in animals to help with injury recovery. A lot of these peptides don't have huge human studies for two reasons. One, because they're natural chemicals or molecules, so no one can patent them and make a lot of money off of them. And also, they've been around for so long that they're not novel anymore.
Oh,
And
okay.
so the traditional way of making a medication, if you're a large drug company, is you make
Uh-huh.
something new
Uh-huh.
and then you spend millions of dollars studying it to prove that it's safe and effective. And if that happens and and you patent it and the FDA gives you approval to sell it and you have a period of time, 15, 20 years that it's at your exclusive use
Mhm.
to make money off of it. Whereas these peptides have been around for so long and they're also natural, which means you can't patent a natural thing.
Oh, interesting.
No one can make a lot of money off of them. So
Uh-huh.
that human data, the GLP-1s do have, because those are novel, those are new.
They're much more regulated.
Yeah.
I
Well, that's
see.
what was regulated is like well
Uh-huh.
studied, and
Okay.
it's tricky because we don't, medicine, you don't want to provide treatments that are causing harm. So we always want to be careful
For
about,
sure.
is this safe is the first question.
Uh-huh.
And for a lot of the peptides, they have been being used for decades, kind of under the radar, like in, specific instances in medicine, like say the growth hormone in children.
Mhm.
And then they're extrapolating that out to say, well, we know this helps and people feel better on it. Let's try this out.
Yeah.
And so it's a very dynamic space. And I think the door was opened by GLP-1s once people realize, oh, if I do this injection, I can feel better.
Uh-huh.
Most peptides, because they're proteins that get broken down in the stomach, they have to be done by a small injection. There are some ones that dissolve underneath the tongue as well. And so people are like, once they saw how much benefit they can get from GLP-1s or maybe someone else they know, there's like, well, what else is there? And there's this whole
Mhm.
world of peptides that are out there. And so there's recovery ones, there's the performance ones. There's also ones used for like skin and beauty. The most common one for that is called GHKCU, which is a
Mhm.
copper peptide that's used in
Mhm.
collagen production, hair formation.
Mhm.
Supposedly, it's the one all the celebrities are taking,
Okay.
but it give you a youthful, or at least for most people, a youthful skin appearance.
Uh-huh.
And so everyone's, kind of looking around like what can help me? There's some for inflammation, there's some to help activate your mitochondria. It's wild. And so we take a close look at we want to, as a in the medical field, like, we want to be real careful about what we're providing. So we look at, what the is it safe and can it show some benefit?
Yeah.
A lot of people are buying peptides right off the internet. It's called like the gray markets or the black
Oh,
markets. And
that's
it's a
scary.
yeah, it's a way to save money and it's a way to get whatever you want. Unfortunately, there's no, quality control or toxin level that's monitored. I mean, people do send these off to third party labs to check.
Right.
However, I mean, we don't obviously don't recommend this,
Yeah.
um, but it is a big thing in the internet world of, you have these, bodybuilders who are like, oh, if you go to, this account and, on Discord and pay with Bitcoin,
Oh
and,
my
it's
goodness.
it's wild. And of course, it's really cheap. But there, my take on it is if you're putting it in your body, it's probably worth taking the time and maybe spending the extra money to make sure it's safe.
Yeah, for sure. I would
Um,
definitely think so.
but
Wow.
but yeah, and so there's all these other experimental peptides that people are trying out. There's some that help with skin tanning, believe it or not. Um, and so I think that'll keep on going. It's tough though because no drug company is going to really extensively study this. So whether what becomes like mainstream and widely accepted versus what isn't, we don't really know quite yet. But for the limited peptides that we've been providing, like people do definitely notice like the athletic performance is pretty a strong improvement.
Mhm.
Um, like for me with the growth hormone peptides that I've tried, like sleep benefit has been really dramatic as well. Just feeling I get more restful sleep.
Wow.
But a bit important thing to note with the peptides is none of these are FDA approved for what we're talking about.
Yeah.
So it's definitely an off-label type thing. And one thing in particular to know about with growth hormone is for some folks with cancer, increasing growth hormone can make cancer worse. So we just want to make sure people don't have cancer before they start peptide therapy or at
Wow.
high risk. Like maybe they just finished a cancer treatment.
Mhm.
Make sure that they've done their cancer screenings. The last thing we want to do is start someone on a medication that makes them ill. Growth hormone analogs have never been shown to cause cancer. It's just that if you have certain types, it can make it worse.
I see. Wow. Is this sector growing a lot as well within your business, in Flow Wellness? Are you seeing more and more clients come to you wanting to try these peptides out there?
Absolutely. Yeah, I mean, we just started doing it 6 months ago. It's been bubbling along for a long time and a
Uh-huh.
years of decades, but
Yeah.
it's really just taken off, I'd say, within the past year. And a lot of it through social media, honestly. I mean, you can go on whatever your favorite account is, type in peptides, and you'll get
Yeah.
thousands of people talking about how it benefits them and where you can order it and all this sort of thing.
Wow. Given that it's such a, popular topic and that, you were very clear that this is not FDA approved, how do you, Kevin, as a doctor, like make sure that you're providing the best counsel to your clients looking for peptides with unknown results?
I mean, the biggest thing for us is the source. Like, we want to find a reliable pharmacy that's,
Mhm.
US based. I mean, these are all done through compounding pharmacies. So it's not a kind of mainstream pharmacy. The compounding pharmacies make unique formulations that are, kind of standardized.
Okay.
And so, one that we trust in terms of quality, and then also just looking at the peptide itself. I mean, typically the ones they're making are the ones that are more accepted, just because they're not going to take on producing something that's dangerous, because they have liability in that as well.
Uh-huh.
And a lot of it is just I hate to it's not in medicine. You always want to do the most rigorous study type thing, but these things just don't have it. So a lot of it is just looking around at what studies there are, what have people's results have been, what are the potential downsides,
Mhm.
and we try and do our best to relay that to people. It's like, hey, this is still, a little bit off label here.
Yeah.
But we have seen a lot of people get benefit from it. That's something you're interested in trying. We can certainly try it out.
Sure. And which are the peptides that are most attractive to the population here in Bend?
We hear a lot about the growth hormone analogs. So Simorlin's the original one. There's a newer one called CJC ipamorelin, which is looking at there's variants of that we can get through compounding.
Uh-huh.
A big one that's in the news is tesamorelin. That's been shown. It's actually FDA approved for HIV patients to help with visceral fat loss.
Okay.
So HIV patients, when they on the medication that they get to treat the HIV, the highly active antiretroviral therapy, the heart therapy, a side effect is they tend to gain a lot of weight in the midsection. And so it's been studied, well, how can we help counteract that? And tesamorelin was the original drug to treat for that was effective. And then people said, well, if it works for this population, will it work for, regular people that don't have HIV with excessive visceral fat? And there's
Oh,
some limited
sure.
study data that it's
Yeah.
helpful for that. But we do have
Yeah.
people asking for that, because it does say, you get to your goal weight on a GLP-1, but you do a body scan and you have excessive visceral fat, and maybe your dad died of heart disease, and you're like, well, I don't want this visceral fat. I know it's bad for me. What other
Sure.
steps are there that I can do to help? If you're optimizing your diet, sleep, exercise, those sort of things, what else can I do?
Mhm.
And so we hear that from patients about the tesamorelin. And then the injury ones are common too. Like, for instance, I had a tennis elbow from
Mhm.
overtraining that just wouldn't go away. I'd been to PT, and, I took a month of the BPC compound and it went away. And of course, that isn't not the case for everybody.
Yeah,
We in
okay,
medicine,
but
we call that an N of one. Like, one person got this benefit, that doesn't mean it applies to
sure,
everyone
that
else.
makes
But
sense.
we hear these stories over and over again.
Uh-huh.
People who have gotten surgery, they let the acute healing period wait a week or two, start some recovery peptides. And we've had multiple people come back, say they saw their surgeon. They're like, wow, you've really progressed further than I thought you would in your recovery. Um, and so, we hear this over and over again, that it is helpful for folks.
Yeah. Wow. I'm kind of blown away by all these new trends and yeah. And just I'm trying to figure out like, the fine line between what we're calling wellness and medicine and, you know, the health benefits that people are seeing. I mean, as someone who likes to get out and, swim and bike and run and sweat and like, get tired, I like to do the work, so I'm wary about, these, pills and peptides and whatnot that kind of do the work for us. Does that make sense? Um,
Yeah, well, one thing to mention is none of these medicines put on muscle for you. You still have to do the
Mhm.
work, like
Right.
with the growth hormone peptides. I mean, you still
Yeah.
have to go to the gym, because it's not going to just build muscle. What
Mhm.
I found, for instance, I go to the gym and actually have energy instead of showing up. I'm like, well, I made it. Let me stay at least 15 minutes. I'm going to go home.
Yeah.
So it helps supplement, um, what you're doing. I
Mhm.
mean, and what you're describing is really a big transition in medicine right now. Is it more? They call it medicine 3.0,
Okay.
whereas medicine 1.0 was the observational, like, herbal remedies.
Yeah.
Like, take this plant, you'll feel better, kind
Right.
of thing.
Okay.
And that's decades, hundreds of years ago, and that
Mhm.
we're firmly in the medicine 2.0 era, which is we can treat disease for the most part really well. If you have a heart
Mhm.
attack, we have phenomenal treatments for you. Cancers, I mean, obviously still needs a lot of work, but there's some cancers that we can completely cure.
Mhm.
But the problem is you have to wait for that disease to happen before you can get the treatment. And now that medicine's evolved and we have all these new technologies, the medicine 3.0 is what can I do to stay well? Like what not only do I want to live long, but I want to live healthy during that time.
Mhm.
And that's what we call health span in addition to lifespan. And that's where these like the wellness industry is kind of keyed in on is, what it's great if you're 100, but if you spend the last 20 years of your life in a nursing home, bedbound, in pain, that's not a life most people would choose.
Right.
But if you can stretch that out to maybe the last, only but the last few years, you're still active, walking around, that sort of thing. That's what people want.
Right. Where health span matches almost lifespan.
Exactly.
Mhm.
And so, for instance, like my grandmother's 100, still lives independently, takes no medications, walks every day. Like that's what people want.
Sure.
That's a pretty rare thing.
But does she take peptides? No.
No, she's never needed them.
That's
She's
what I'm
she's the hardy
saying, like,
type.
I mean, my grandmother died too when she was 99, and she was in her bed for, 4 years before she did, but she was always really active, social, she didn't take any medication, and that's what I'm saying, like, I'm more of that nature, like, I just wanna do the work myself, eat healthy, not eat processed food, not do fast food, do my exercise every day, do my meditation to, sleep well at night. So that's why I'm a little bit wary, I know
Mhm.
that these are gonna they're here to stay. I know a lot of us, need kind of that work to be done for us,
Yeah, absolutely.
right? So, yeah.
Yeah, I mean, if you wanna live a long, healthy life, like, just
Uh-huh.
taking a pill or a shot isn't gonna do it for you.
No, I agree.
And so these are really adjuncts, it's like
Mhm.
what a supplement of, some
Okay.
people are, they're born with obesity, like, it runs in their family, they have genetic predisposition to it, they've dealt with it all their life, so being able to treat that is, that's gonna be a medication
For
for
sure.
for
I
most
understand that.
people.
Yeah, for those genetic cases. Yeah.
And as far as, like, the peptide stuff, I mean, I think for most people as they get older, like, their body slows down, injuries become harder to recover from,
Uh-huh.
their exercise tolerance goes down, and that can be treated by other methods, hormone replacement, something that we also do.
Yeah.
And so, it's finding that balance of, like, what do you wanna do on your own? How is that working for you?
Sure.
And, is there something else that may be helpful? One of the things I found entering the wellness space is that there's just thousands of treatments that are out there, and you just find the one that works for you. For
Mhm.
instance, some people swear by acupuncture. My wife does. When I went, it was really painful. I didn't think it could
Yeah.
help me at all, but I'm not saying it's a bad thing. It just didn't work for me personally.
Sure. No.
And so you find what works for you and go with it. And if
Yeah.
that's medication, great. If that's something else, that's great. If it's, just diet and exercise is getting you where you want to be, and that's phenomenal too. Like you just find the thing that's going for you and stay with it.
Yeah, for sure. Last question, Kevin. So, for someone who has transitioned into this wellness space after being an ER doctor, what's your non negotiable, for your own health and wellness? What do you do consistently? You know, no medication, no drugs, drugs aside.
Oh,
Like, what do you think is the key to keeping healthy and well?
well, for me personally, I stopped working overnight shifts,
Uh huh.
and I feel bad saying this because I'm still a little bit. I still work in the ER part time, and so I
Yeah.
have colleagues that are still in the
Okay.
thick of it. But
Oh,
as I got
sorry.
older,
Yeah.
the night shifts were just, so they were just physically bad for me. I just
Yeah.
could feel it, and I think I could handle it fine when I was younger, and
Hmm.
I could do those all day long. But now it's just too much. My body's changed, and so for my
Hmm.
personal health, like valuing my sleep has been really important.
Hmm.
And also for me personally, I think, more universally is exercise. Like I feel like I've hit the age where if I'm not moving, I just start stiffening up and I'm in pain, and
Yes.
so I'm always trying to be moving.
Hmm. And how I always like to, bring in the subject of Ben. We're here. All the people I've brought into this podcast live, work here. How does having Flow Wellness here in such a unique city like Bend, with such beautiful surroundings and such an active lifestyle that it provides us with, like, how has that enriched your own experience as a doctor? And being the director of Flow Wellness, like, how does the population work with you and this
I
culture?
think people are like you move to Bend because for most people they tend to be outside oriented, but that does take a level of physical fitness, even if it's just going for a hike that a lot of us take for granted, honestly.
Yeah.
But when you get that taken away, that's all you think about. And so being in a position where we can help people get back to that is really
Mhm.
powerful. It's been really rewarding. Unfortunately in the ER, what we do is give a lot of bad news out day in and day out. And it's nice to turn that on its head and take a problem and actually help with that person's work with them to have them solve it and get back to where they wanted to be. That's been really rewarding.
Yeah. Well, thank you very much. I really appreciate your time and your experience having come into this podcast.
Well, thank you. It's been great talking with you.
Thank you.